Part three of my series on the chronology of the pandemic. By around February in South Korea. South Korea was the second country that was hit hard by the coronavirus. It became obvious that there was a big epidemic problem, but it was localized mainly in a city called Daegu, and it was localized by a particular group, a group of Christian fundamentalists, a cult really called Shinjeonji. And the epidemic was contained pretty much through contact tracing and quick quarantining by the South Korean government. Nevertheless, the virus did spread through the country and eventually ended up spreading in Seoul, which is now the epicenter in South Korea. Meantime, in Canada, what was happening was the government was very slow to react. It was sort of slow to get what was going on. And this happened in the United States in a sort of weird, kind of bigoted way. In the United States, the Trump administration decided to ban flights from China, which, according to Anthony Fauci, did have some positive effect. But by that point, the virus had spread internationally. So other flights were flying into the United States, bringing in the virus anyway. In Canada, there was a really feeble attempt to control the airports. Bill Blair, who's still in the Trudeau cabinet, was in charge of the airports, and he claimed to be controlling visitors, travelers coming into the country. But according to, for example, Olga Stein, who was at an airport, I think around that time, there was very little, or was observing what was going on, there was very little control over who was coming into the country. Simultaneously, as my friend Doug Allen pointed out, the whole issue of masking was a disaster in Canada, the way it was sort of presented. Theresa Tam, who was the public health officer at the federal level, who's still in power, was advising people not to mask, average people not to mask. Now, the argument at that point was there was a shortage of N95 masks, still hard to get in Canada, and that they had to be reserved for healthcare workers. But instead of just saying that plainly, there was this sort of weird, baroquely convoluted argument that masks didn't work for average people, but they did work for health workers. So that confused messaging is something that Canadians are still paying the price for.